I will tell you in short about a particular type of diabetes called type 1 diabetes. Type 1 diabetes is usually because of autoimmune factors, and it is affecting the cells of the pancreatic insulin secreting hormone cells. And when those cells get destroyed, the person gets diabetes mellitus type 1 at a much younger age group. And this can also be affected by other environmental factors. These people don't have much of insulin being produced in the body, and they need to be given insulin from outside to sustain themselves. And therefore type 1 diabetes are very genetically predisposed. We shall discuss something about the role of family in controlling diabetes. It's important that all the family members cooperate in controlling a person's diabetes. For example, if a person is obese, you try to motivate him to control his diet and also to exercise regularly. It's important that the family assists in making him less depressed and try to motivate him to do more of exercise and see to it that this doesn't get transmitted in generations to generations. As a family, it's important that one should realize the role of taking precautions in lifestyle modifications. And also, it's important that these patients who are having psychological issues like depression should be treated so that they are motivated to remain healthy and take care of their body weight, and also to see to it that their metabolism is preserved. Diabetes in women can be a big challenge. It is seen that people who have diabetes, women especially, have double the complications of men of having diabetes in men. It's important to understand that these women are more prone to develop heart attacks and other problems like blindness or cerebrovascular accidents or recurrent infections. They manifest as a manifold complications much more than men who are diabetic. And therefore, it's important that women should take more precautions to prevent diabetes by way of lifestyle. And it's also seen that pregnant women who have higher risk of complications in pregnancy and also nurturing bad birth defects in children who are born out of them. It's important that therefore during pregnancy these people have their sugars checked regularly and controlled properly, preferably with insulin, and then these precautions will lead to a better child health, and also the children born out of them will have a healthy future. And this is important to understand because the risk in women is much more than diabetic men. I would like to talk to you about a familial type of diabetes. Diabetes is one of the commonest diseases that we face. It is mostly due to hereditary factors when it comes in as type 1 diabetes, and type 2 diabetes also is related to environment, lifestyle and food habits. And it is seen in many people that people who have genetic transmission of diabetes, it is not necessarily that they should get diabetes, but many other factors like environment and diet and lifestyles are important. And the reason why we say this is because in twins who are identical, one of them may have diabetes, the other person may not have diabetes. The other person may develop diabetes later on due to other risk factors like lifestyle, obesity and lack of exercise, poor dietary compliance. All these can lead to type 2 diabetes. Is diabetes hereditary? Is a big question mark. Hereditary is a person having by ways of genes transmission type 1 or type 2 diabetes, which is influenced also by the type of lifestyle this person has. Usually these people are quite obese and they have developed what is called insulin resistance. Insulin resistance is a situation where the body's insulin is not utilized for metabolism, and therefore the blood accumulates glucose in the body and it leads to high levels of blood sugar or diabetes mellitus. It's important that these people should control their lifestyles properly so that they burn the calories as much as they can by way of diet and exercise, and also try to keep their body weight in limit. And therefore, it's important that a person who has a hereditary predisposition for diabetes should take extra care to see that they remain fit and they adhere to the norms of exercise and diet, and also see to it that these extraneous factors do not harm them to lead on to diabetes mellitus.